Targeted therapy in non-small cell lung cancer. Targeted therapy is a cancer treatment directed towards specific mutations that drive cancer to grow and spread. Targeted therapies interrupt the growth and function of cancer cells while avoiding healthy cells, so there can be fewer side effects than with standard chemotherapy. You may qualify for targeted therapy based on the results of biomarker testing that looks for all known mutations driving non-small cell lung cancer, or NSCLC. The tests look for specific molecular signs and substances that reveal a cancer's mutations. Experts recommend that everyone diagnosed with non-small cell lung cancer have testing for the presence of driver mutations in the tumor as soon as possible. This testing allows the doctor to prescribe treatment that is tailored to your individual cancer. Targeted therapy offers hope for people with non-small cell lung cancer. Many people live longer with targeted therapy. It may also cause fewer side effects. The mutations that help non-small cell lung cancer grow and thrive are called driver mutations. They drive cancer activity. Knowing your cancer's mutations allows you and your doctor to choose the best targeted therapy based on your cancer stage, general health, and preferences. Experts recommend biomarker testing for the driver mutations EGFR, ALK, KRAS, ROS1, c-MET, RET, NTRK, and BRAF V600E, as well as for levels of the protein PD-L1 when you are first diagnosed with non-small cell lung cancer. Doctors also recommend testing for biomarkers if you have stage 4 non-small cell lung cancer, your cancer spreads or returns after treatment, or you did not have biomarker testing at diagnosis. Experts are also studying new drugs based on other biomarkers. You may be able to join a clinical trial for a new medicine not yet available to the public. Biomarker testing is important for everyone, including people from certain groups such as African Americans. In the past, lung cancer rates have been significantly higher in this group. For example, African American men had higher rates of lung cancer than white men and were much more likely to die of it up until the recent past. This is changing, but the death rate and rate of new cancers is still higher in the African American community. African Americans tend to be diagnosed at later stages of non-small cell lung cancer and wait longer for treatment. This and other factors lead to lower survival rates than for white Americans. This is especially true for African American men. Biomarker testing can help more African Americans receive targeted therapies, which improves survival. Some other minorities also tend to have higher lung cancer rates and receive less treatment. If you are American Indian, Alaska Native, or a Pacific Islander, be sure to ask your doctor about comprehensive biomarker testing. Targeted therapies for specific mutations can be used as the first treatment or first-line treatment for non-small cell lung cancer. They can also be used later as a second treatment or second-line treatment. As an example, for the EGFR mutation, the medicine osimertinib is the first-line treatment. If the cancer grows with this treatment, doctors can prescribe other targeted therapies. For the ALK mutation, first-line treatments are alectinib, lorlatinib, or brigatinib. Ceritinib, or any of the drugs not used in first-line treatment, are second-line options. It is important to repeat testing for driver mutations if the first-line treatment does not work, because the second-line treatment depends on the cancer's mutation profile at the time that it progresses. Entrectinib is the preferred first-line treatment for people with a ROS1 mutation, especially if the cancer has spread to the central nervous system. People with a mutation called BRAF V600E can receive a combination of two drugs, dabrafenib and trametinib. This may be a first- and second-line treatment. Immunotherapy is used when there are changes in the protein PD-L1. It includes nivolumab, pembrolizumab, and atezolizumab. Durvalumab is also an immune therapy drug that is approved for patients with stage 3 non-small cell lung cancer after receiving chemotherapy and radiation. Immunotherapy allows the immune system to better attack cancer cells. These drugs may be a first-line treatment when cancer has metastasized, or a second-line treatment if chemotherapy does not work well and certain mutations are present. If your doctor suspects lung cancer, ask about comprehensive biomarker testing. Experts recommend it for everyone with non-small cell lung cancer. If you did not receive it, talk with your doctor about doing the tests now. Targeted therapy can make an important difference in your health outcomes.